My name is David Wilson. I'm going to talk about the enzalutamide in men with non-metastatic castration-resistant prostate cancer. I'm from the Catholic University from the city of Guayaquil. The studies have hypothesized that the enzalutamide, which prolongs overall survival among patients with metastatic castration-resistant prostate cancer, will delay metastasis in men with non-metastatic castration-resistant prostate cancer and a rapidly rising PSA level. In this double-blind phase 3 trial, we randomly assigned in a 2:1 ratio men with non-metastatic castration-resistant prostate cancer and a PSA doubling time of 10 months or less who were continuing androgen deprivation therapy to receive enzalutamide at doses of 160 milligrams or placebo once daily. As of June 28, 2017, a total of 219 of 933 patients, that means 23% in the enzalutamide group, had metastasis or had died, as compared with 228 of 468, that is the 49% in the placebo group. The median metastasis-free survival was 36.46 months in the enzalutamide group versus 14.7 months in the placebo group. At the first interim analysis of overall survival, 103 patients, that means 11%, receiving enzalutamide and 62, that means 13%, receiving placebo, had died. Adverse events of grade 3 or higher occurring 31% of the patients receiving enzalutamide, as compared with 23% of those receiving placebo. There is a video that will show you how it works.
The Cancer Registry is a large registry sponsored by Janssen Pharmaceuticals. It's a registry of over 3,000 patients across Europe. And it's basically the largest and the first real-world data that we've got of men with metastatic castrate-refractory prostate cancer. So, for those who aren't familiar with prostate cancer, this is men whose disease is getting worse despite having had lowering of their testosterone. So, castrate-refractory prostate cancer is a relatively new term in the last 5 years, and it basically means prostate cancer that is getting worse despite us having lowered testosterone to castrate levels. And this used to be an area where there was very few treatments that have been shown to have a benefit. And one of the registry recognises that actually several treatments have now shown significant improvements for our patients. So that's abiraterone and enzalutamide, which also target androgen receptor biology, radium-223, which is a radiopharmaceutical that targets bone metastases, which are the predominant site of metastases for prostate cancer, chemotherapy with docetaxel and cabazitaxel. So what was an area of very little treatment now has several. So the registry recognises that and is trying to get some real-world data of those treatments in this very important and common disease. So we have data on 3,000 men. They're going to be followed for up to 3 years. And we're going to look at how well the treatments work. We're going to look at comorbidities. We're going to look at sequencing of treatment. And I think clinical trials are fantastic things, and they lead to drugs being registered. But they don't always reflect the real world, as you'll know. Many patients are excluded because of age, fitness, comorbidities. And so the registry is allowing us to see how those patients do, so patterns of practice, as well as a real glimpse of how things are in our clinics. Well, the registry is now fully enrolled, so it's fantastic. It enrolled very quickly with 3,000 patients across several European countries, I think over 19 countries. We were lucky in the UK, we put in over 300 patients from the UK. So there's no more enrolment, but it's very important we keep on following up those patients so we get the robust data, particularly on which drugs are being used, how well those drugs are working, and also sort of sequencing of drugs. We've presented some of them, so we presented some of the data today at the European Society of Medical Oncology meeting. So we presented data on almost 2,000 patients who've been followed for at least a year. And that gives us a hint of where the drugs are being used. We use sort of chemotherapy as a guide because some of the studies were done in sort of what's called a pre-chemotherapy or post-chemotherapy setting. So we can see that the majority of abiraterone and enzalutamide, which are probably the drugs which have made the biggest impact in my opinion, we can see that they're being used predominantly prior to chemotherapy. We can see those drugs are very active. And that the activity that we see in clinical trial setting is being reflected in the real world. We can see that's despite having more patients, say, over the age of 75 and more patients with significant comorbidities. It's a fascinating data set, and it's only going to get more and more interesting as we get longer follow-up. So we'll see actually what patients are having in the clinics and also patterns of care across Europe. Different countries, as you'll know, have different access to drugs, different clinicians that are involved. As a summary with regards to the registry, it's a really valuable piece of information. It's only going to get more valuable as the data matures. But it provides us with this very large group of patients, 3,000 men, treated in a real-world setting, not clinical trial patients, so reflecting an older patient population we actually see in our clinics. And we'll really see what effect those drugs are having, the sequence and availability of those drugs, and how they work in the clinics that we're doing every day.
So we have a large trial that supports the use of enzalutamide in M0 CRPC, metastatic, non-metastatic prostate cancer with a rising PSA. The PROSPER trial showed almost a 2-year improvement in the development of metastasis. The study had not shown yet an overall survival advantage, but the benefits of delaying metastasis and the quality of life of men is very significant. So the opportunity to use enzalutamide in patients who have M0 castrate-resistant prostate cancer is a very promising development.
For the conclusion, we could say that among the men with non-metastatic castration-resistant prostate cancer with a rapidly rising PSA level, enzalutamide retreatment led to a clinically meaningful and significant 71% lower risk of metastasis or death than placebo. Thanks.